Covering your health now, the diabetic drug Ozempic is in short supply, according to the pharmaceutical company.
And doctors say lots of people are using it for weight loss. That's because it uses the same ingredient as another weight loss drug known as Wegovy. But what is the difference between the two medications and who are they intended for?
Well, Fox Carolina's Carrie Beal spoke with Bon Secours bariatric surgeon Jessica Gonzalez Hernandez about that difference between the two.
They are the same medication, but when you prescribe it as Wegovy, you're able to go to a higher dose per week.
Dr. Hernandez says Ozempic was approved for diabetes and is a low dose of semaglutide. Patients can take up to 1 milligram per week, whereas Wegovy, which was FDA approved for weight loss, is a higher dose. Patients can take up to 2.4 milligrams per week.
And if somebody is taking Ozempic for weight loss, not necessarily for type 2 diabetes, is there something that they should know? Is there a consequence they could face, side effect? I know you're not supposed to, but I think people unfortunately are. If you're taking Ozempic for weight loss, what could be the consequence?
So, Ozempic is the same compound that Wegovy has for weight loss. So, and we start at the same dosages. So you can take Ozempic for weight loss if you're able to, get your insurance to approve it, or you're able to afford it. You can take Ozempic for weight loss, but you definitely want a doctor to be monitoring that and making sure that you're doing it the right way, and that if anything were to happen, they're able to manage it for you.
And then for Wegovy, the weight loss drug, how effective was it in studies, and what have you seen personally?
So studies show that you could have up to about a 17% of weight loss of your total weight in 56-week period. I have patients that have done very well on it, other patients that have not responded as well. So that's why, I usually say that for obesity, there's not like one fits all treatment. Every patient may respond differently to different medications. But Wegovy and Ozempic, they both, I have patients that are very successful on it. I have patients that have lost between 30 and 40 pounds in 1 year. And it will all depend the percentage based on what weight they started on. But yes, anywhere between 12 and 20% I have seen so far in the last year on the patients that have been on Wegovy and Ozempic.
And how does this compare to other weight loss drugs that you've seen?
So there's other medications, right now in terms of percentage of weight loss, semaglutide, either Ozempic or Wegovy, a brand, is one of the top ones. The second best is the combination of phentermine with topiramate. But that one does have the risk of rebound weight regain after you stop the medication. Mm-hmm. So the semaglutide seems to be a very a medication that patients like, because they only inject themselves once a week, every week, versus other medications they have to take every day.
Now, is there anyone that shouldn't be taking Ozempic? I mean, there's been a shortage, and I think a lot of people are trying to get it because, as you mentioned, it's covered by insurance, whereas Wegovy is a weight loss drug often not covered by insurance. So is there any danger of taking Ozempic if it's not prescribed to you or you're not supposed to get it?
So there's actually Ozempic and Wegovy. They both have a black box warning of patients that have family history of thyroid nodules or thyroid tumor or thyroid cancer, because they did see that on mice, those mice were higher risk of developing thyroid cancer. So there is a black box warning for patients that either have personal history or family history of thyroid cancer, thyroid nodules, thyroid mass, or if they have any history of medullary thyroid carcinoma. Those are the major black box warning to avoid taking Ozempic or Wegovy.
And that was our Carrie Beal reporting. Other side effects for Wegovy include abdominal pain and headache, fatigue, and low blood sugar. So make sure you check with your doctor before starting either medication.